Your surgery is rapidly approaching. This video is designed to help you with your preparation before and after your joint replacement surgery. To begin, a few items we will be discussing are communication with your healthcare team, packing the appropriate clothing for your hospital stay, and what you must bring to the hospital with you, and those items that you should leave at home. It is recommended that you call your health insurance company to confirm that your surgery has been pre-authorized. You may want to ask them questions about your copay and what services are covered when you are discharged from the hospital. About 14 days prior to your surgery, you will receive a phone call from the hospital. The purpose of this call is to register you for your hospital stay. The person speaking with you will ask you questions about your insurance, and they may ask you to prepay your insurance copayment. The day prior to your surgery, you will get 2 phone calls from the hospital. One call will be from a nurse who will answer your last-minute questions, and she will instruct you to have nothing to eat or drink after midnight. The nurse will also confirm what medications you should take the day of surgery. Be sure to tell the nurse about any changes that you have had in your medications, or if you've been sick, have a cough, or feel ill in any way. The other call will be in the afternoon. This call is from the secretary giving you your arrival time for surgery. The time she gives you is the time that you need to check into the surgical services area. Your arrival time is approximately 1.5 hours before your surgery time. If your surgery is on Monday, you will receive these 2 calls on the Friday before your surgery. Following surgery, we encourage you to change into your regular clothing as soon as you feel up to it. You will want to pack 2 sets of comfortable clothing to wear for physical therapy. This usually includes t-shirts, shorts, or sweatpants with drawstrings. If you are having knee replacement, the dressing on your knee will be quite large, so be sure to wear pants that are loose around the knee. This is also true of hip replacement, except the dressing is on your hip. If you're having shoulder replacement, we recommend that you wear shirts that button down the front. Most people prefer to wear hospital socks to therapy, but if you would like to wear shoes, please make sure that they are fully footed shoes and not slippers. You are welcome to bring your own hairbrush, toothbrush, and toothpaste. If you wear dentures, you may want to bring your denture cup for soaking them, or the hospital will provide one for you. If you wear hearing aids or eyeglasses, please bring their storage cases with you. There is free Wi-Fi internet in each hospital room. You may want to bring an electronic reader or a laptop to use for your hospital stay. If you use CPAP, please bring it with you to the surgery check-in. Be sure to write your name on it, and the nurses will make sure that you will have it during the recovery phase. We ask that you leave all your medications at home. The nurses will make sure that they have a current list of your medications, and the hospital pharmacy will give you your medications while you are in the hospital. It is required that you remove all jewelry prior to surgery. This includes wedding rings, watches, and all body piercings. All jewelry is removed for your protection during surgery. Please bring your insurance card and photo ID with you to the surgery check-in area. We recommend that you take these 2 items out of your wallet and give them to a family member for safekeeping. Leave your wallet at home, as there is no need for money or credit cards during your hospital stay. On the day of your surgery, we recommend that you access the Dixie Regional Medical Center building through the northwest entrance by the flagpole. Free valet services are available to you at that entrance. Upon entering the building, you will be on the first floor. In front of you, you will see a wall lead you to the registration kiosks. These kiosks are where you will check in for surgery. Follow the instructions listed on the screen. After you are finished checking in at the kiosk, get in the elevator and come up to the second floor. As the elevator doors open, you will see a sign overhead that says Surgical Services. Check in with the receptionist at the desk straight ahead. They will ask to see your ID and your insurance cards. They will also have you sign admission papers, consent forms, and have you verify that your information is correct on these forms. When the pre-op staff is ready for you, a nurse or a CNA will take you back to the pre-op room. You may bring 1 or 2 family members or a significant other with you. They will remain with you until you are taken to the operating room. You will be weighed and measured and asked to change into a hospital gown. The CNA will then take your vital signs. Your nurse will review your health and medication histories, ask when you last ate or drank, and verify which medications you took that morning. An IV will be started through which fluids and medications will be given to you during surgery and afterwards during your hospital stay. You may be asked to take an oral medication, and you will receive an antibiotic through your IV to help prevent infections. One of the hospital staff will complete a skin prep on the operative joint, which may include hair removal with clippers and a scrub with antimicrobial soap. Once preparation for surgery is complete, you will wait until the operating room and your surgeon are ready for you. Be sure to speak up if you have any questions or concerns, and use the call light if you need any assistance. Once you are prepared for surgery and it is time for you to go back to the operating room, you will meet one of the pain service nurses. The nurse will wheel you into the block room. There you will meet your anesthesiologist, who will talk to you about your anesthetic choices, which may include general or spinal anesthesia based on your health history and preferences. The anesthesiologist will talk to you about pain management, which may include a femoral nerve block based on your health history, surgeon preference, and your desire. The femoral nerve block is given in the block room before you go to the operating room. You will have the opportunity to talk to your surgeon and OR nurse prior to surgery. This will allow you to ask any last-minute questions that you may have. You will be in surgery for about 1.5 to 2 hours, after which the surgeon will come out to the waiting area to talk to your family members or significant other and let them know how everything went. The anesthesiologist will take you to the operating room on a gurney. At that time, your family members or significant other will be asked to wait in the waiting area. You will be taken to the recovery room where you will stay for about an hour. Your family members or significant other will be told your assigned room number on the nursing unit and be invited to wait there for you. After your surgery, you will be wheeled to the post-surgical unit where you will stay until you are ready to be discharged. On the whiteboard in your room, the staff will write their name, the date, your pain goal, and your goals for the day. They will also educate you about your medications and what possible side effects may occur. There is also a place on the whiteboard where you can have the nursing staff write down any questions that you may have. We want you to feel safe and secure after your surgery. It is important to us that you have an understanding of the different devices that might be attached to you after surgery. These devices are all used to help you heal in the best way possible. You will have oxygen after surgery. You may be a little sleepy, but this supplemental oxygen will help provide adequate air while you rest. The nursing staff will monitor your oxygen levels frequently and will remove the oxygen at the appropriate time. The IV that was placed prior to surgery will remain in your arm until you are discharged. The nurses can disconnect the fluid during your physical therapy sessions, but you may need to be hooked back to it periodically for medications. Some patients also have a urinary catheter. This is a tube that is placed in your bladder to drain the urine into a bag. This helps as you don't have to get up to go to the bathroom as often. The catheter also aids the nurses in monitoring kidney function and hydration levels. Usually, you'll only have the catheter until the next day, and it will be taken out as soon as possible. All patients will have special boots on their legs called sequential compression devices, or SCDs. These boots will be wrapped around your legs, and they will expand and deflate as air is pumped into them. This squeezing motion may be uncomfortable at first, but don't be alarmed, as the compression will help your blood circulate back to your heart. This prevents potential life-threatening blood clots from forming. It is important to wear the SCD boots every time you're in bed. Another device that will help you while you heal is called the incentive spirometer. A respiratory therapist will teach you to use this device to do special respiratory exercises. Doing these exercises will help prevent complications such as pneumonia. You may have a wound drain to collect excess drainage. If you have one of these, it will be removed before you go home. One of the most important things that you will do after surgery is participate in physical therapy. We have highly trained physical therapists and a state-of-the-art gym to help you. Our gym is designed specifically for total joint patients. Your first session in this gym will be the day after your surgery. Ask a family member or significant other to be your physical therapy coach. They will coach you at home with your exercises. We encourage your coach to come with you during your therapy sessions. The dining room is designed specifically with you in mind. Walking into the dining room, sitting down, and standing back up again are all part of your rehabilitation. We try to make this as pleasant as possible by offering delicious food, a beautiful view, an area to socialize, and television entertainment. Your food is served to you and your coach by the dining staff. This video shows the general flow and process. Your procedure may vary a little depending upon your specific needs. If you have any questions, please ask your doctor or nurse.